Mr. Mayor, we're here again to talk a little bit about what's going on at Doylestown and in the community. Not exactly the circumstances we'd prefer to get back. I can't wait to get to where I can even shake your hand again. Right. But we're here, and an important set of messages we need to give, I think.
I think what is on everyone's mind is how is Doylestown Health doing, and how is your staff doing? Maybe you can share some insight in that.
Right. So Doylestown Health is doing exactly what it planned to do. We prepared for this moment early, a situation that no one can really be fully prepared for because we're all learning as we go, but we are doing exactly what those ladies designed us to do years ago, which is to have a resource for this community to provide for its health needs. And so we are doing that today. We've had a number of patients come into the hospital that we've taken care of and are continuing to. We've had a number of people tested through our drive-through testing site, and we have now almost 200 patients in the community that have tested positive but are being managed in home with less acute symptoms. And our staff is handling it beautifully. I mean, it's scary. It is a scary situation for all of us, but we're providing those services. This is the tough time because we're seeing the highest volumes, hopefully the highest volumes we'll see. But it's tough because the intensity is higher for us too, and that's a challenge. But we're doing that really well, much as a function of the support we've received from this community. I mean, tremendous outpouring of support by food and supplies and financial resources. That's really been a lifeblood to keep us going and keep us very energized and supported in the things that we're doing.
You know, there's a lot of conversation nationwide about PPE and whether or not you have enough and what enough might actually look like. How do you view that in terms of Doylestown Health?
So this is a function of almost a just-in-time supply model. I mean, every day we track what's the number of days on hand we have on every single item that we have. Right. Different ones are more scarce than others. N95 masks is one of the big things that everybody hears about. But now we're into the community where we're all wearing masks today, right. And that's a very important issue. And we're having cloth masks be made by our friends at Buyer's Choice and other places that are contributing. Folks are putting them together in personal ways that are providing us support. So we're giving those to all of the community folks that come in and making them available. So we're doing okay, but that's really a challenge. We're constantly looking for additional supplies just because of the demand that it takes.
Right, and those supplies are hard to identify and hard to get a hold of quickly.
Well, yeah, they're hard to get a hold of quickly is really the issue. But boy, I'll tell you what, the other issue is that the community has responded beautifully to those needs too. Places that you might not otherwise think. The realtors have booties that they use when they go into homes to show homes. So they've donated that. A lot of the auto folks have had N95 masks and other things they use in their own industrial and commercial work. They've provided those donations. Johnson & Johnson and Merck and other community resources have provided support to us as well. So we're getting positive support as well as purchasing the things that we have, but it's almost an endless supply need until we know what the final outcome is going to be here.
So if there are people in the community who still haven't stepped forward to find a way to support the hospital, but want to, and I think there are people that want to come forward, what would you tell them to do, or where would you direct them?
So the Doylestown Health Foundation website is where we post regularly all of the critical needs that we have, particularly our priority needs. And it modifies from time to time based on what the most important issues are. The simplest thing that really provides us a great deal of flexibility is an unrestricted gift. Sure. That allows us to use those funds in the most effective way. But we're thrilled to have food come in. We have a whole process now, a design process for receiving the food and distributing it, and it's across all of our units and all of our folks. I mean, it's not just the nurses and the doctors who are doing tremendous work, but it's the housekeeping folks, and it's the food and nutrition folks that are here, and it's the techs that are here, the redeployed staff, folks that were not doing normal work that we would do in the hospital, but we have folks at the front doors, we have folks transporting people. Everybody has volunteered, and not only here at the hospital, but throughout all of the Doylestown Health system. So we've got folks going to Pine Run to help out. We've got folks into the community that are helping out. It's been a full-on effort by everybody. It's tremendous.
In the news, there's a lot of conversation about treatment options. How does Doylestown Health participate in that?
So one of the really impressive things about this team here is that they are not only good clinicians, but we're researching everything and looking for best practices. So we're one of the hospitals that started proning patients in the intensive care unit. That's moving patients onto their stomach so that they can breathe better. That's having some very positive results, and we're doing that here. We also qualify here for a number of the clinical trials that are going on, which is really exciting. One of those issues is convalescent plasma, and so we are one of the places that's doing that today. So there are some cool things that are happening, exciting things, not yet fully for prime time for across the board, but we're participating and having access for our community for some of the best practices. Again, I got to say, it's the ladies of the VIA, when they created this hospital almost 100 years ago, they wanted Doylestown to be a place that families could get their care without having to go someplace else. And we are absolutely proven that they had a good idea, and we're taking full advantage of it here today.
Great. You know, the community also has been involved in a tremendous way in terms of what I call voluntary compliance, in terms of social distancing. We've done exceptionally well with that, but there's always room for improvement, and frankly, what I sense right now is, as we get further into this, the chance that there's going to be complacency increases. It increases simply because, you know, we're in that process. And we need to find new ways to make sure everyone is cooperating with that voluntary compliance. And of course, we have part of that in view today. Going forward, wearing masks, in my mind, and I think the scientific evidence proves that out, wearing masks is extraordinarily important whenever you leave the home. Obviously, when you go to those locations which we've determined to be essential, like shopping for groceries or going to a pharmacy, or even using takeout from one of the restaurants. Wearing a mask is essential, but correct me if I'm wrong, I think it's essential whenever you leave the home, whenever you're walking down the street.
So that's absolutely correct, and it's another level that I think we're learning about what do we need to do during this period of time. The use of masks that we're using today out into the community is to protect others from us.
Right.
It is not just about protecting us. Hand washing, which is also, it's been from day one of the most important issues, is hand washing is still pretty critical as we think about what's happening. So keeping clean, keeping good standards relative to hand washing every time we're out, using masks, all is an important aspect of this. It's also important to realize that as the weather breaks, everybody's going to want to get out.
Absolutely.
You know, I mean, we're
Absolutely.
all ready. I mean, we've got four children at home that would otherwise be in elementary or middle school today, and they're doing online learning. But oh my gosh, they are so ready to get out and do things, and it's okay to get out. Mm-hmm. It's okay to get out, but keep social distancing. And also realize that keeping masks on and washing hands and being very vigilant about that is absolutely essential. You are not only protecting yourself, but you're also protecting others.
I think with that message, we'll leave it for there until probably next time, probably in a few days, but I think we got the message across.
I think we did too, and I do want to close with this thank you again to the community. Yesterday I was with a couple of gentlemen who have now twice come and serenaded the hospital out of the back of their truck in the upper part of one of our parking lots. We had a car parade come through and thank our folks. We've got a beautiful sign out front. This community is just an unbelievable place to be a part of, and thank you. It's a total community effort that's making a difference.
So we've talked a lot about social distancing and what we need to do going forward. So as I say goodbye to you for this day, I'm putting my mask back on.
And I am too. So let's go be healthy and enjoy the beautiful weather and be safe.
Thanks, Jim.
Thank you.